Good afternoon and welcome to another Monday webinar. My name is Dr. Ken Stewart and I'll be your presenter for today. Today's topic is venturing out with COVID-19, staying safe, part 3. All right, part 3, for the past couple of weeks, we've been talking about what you can do to protect yourself as you ventured out into the world or into the community and what you can do. So before we get started, I would like to just remind you to check out our YouTube channel, Epic Health Education, and we have over 70 plus YouTube videos or webinars that you can check out, that you can learn more about as it relates to various topics to help you stay safe, but to also help you stay healthy. Before we get started, I just want to highlight just the I've been doing this for the past couple of weeks, and the basics as we try to get a handle on COVID-19. A couple of highlights I want to mention. One is to keep at least 6 feet of distance from the other person. Wear a mask that covers your mouth and nose. Wash your hands before, if you can do it, during your time outside, but also as soon as you come in. And if you are sick, do not go outside. If you have to, well, first I recommend try to get some family members or friends to help you with buying essentials. But if you have to go outside, sure, you are bundled up, gloves, mask covering your mouth and your nose, and make sure you have your hand sanitizer. All right, so with that being the case, let's get started. So right now, airlines are getting hit hard by this COVID-19 pandemic. So you have a lot of airplanes traveling with a low amount of passengers on their planes. You have less people going to the airports. So you have a lot more space to move around. However, even though there are less people there at the airport, you are still at risk. You are still at risk. So the question is, what to do when venturing out to the airport to travel? Yes, airports are empty now. Many have closed, some security checkpoints to consolidate staff. So, one concern, you may need to wait in line. So that means you have to keep your distance 6 feet apart from others and keep your mask on unless a TSA officer asks you to remove it. So a couple of things to keep in mind. Limit your contact in the terminal. If you can, sit away from the other passengers waiting to board. Bring your own food if you're worried about hunger. As you know, the prices at the airport are astronomical, so bring your own food. Many terminal restaurants and shops are closed also, so make sure you bring your own food. Carry wipes with you. You can carry disinfectant wipes and hand sanitizers in your carry-on luggage, so keep them close for when you board your plane. You'll want to wipe down the tray table, seat belt buckle, the air vent over your head, anything a previous passenger might have touched throughout the flight. Make sure you wipe very well. your headrest, your armrest, the air vents, your seat belt buckle, your tray table, or better yet, your whole chair. Make sure you wipe. If possible, sit apart. I know certain airlines are trying to keep the middle seat open, but if you can sit further apart, that's good. Try not to sit in the same row as another person, if at all possible. At least one airline, Alaska Airlines, is offering passengers a refund if they can't seat them away from other people. So that is venturing out to the airport, going on a trip using airplanes. Clinics. Throughout the pandemic, physicians have asked people to postpone non-essential healthcare visits. But many clinics are restarting those now. Over the past couple of weeks, you had the opportunity to see your provider or see your medical personnel that assist you via Zoom or via telehealth. But now, certain medical establishments are now encouraging you to come back, come into the office. So you want to be mindful of a couple things. Be mindful of your surroundings. If you have an appointment, be mindful in the waiting room. Try to sit 6 feet away from others and avoid touching those months-old magazines or books left out for guests. Anything that others might have touched. So be careful. Like I mentioned in a previous video, if not just the barber shop or my barber, why can't these providers or medical offices invest in those devices that the restaurants give out to let you know that they're ready for you? It shakes, I forgot what it's called, but it shakes, and that alerts you that they are ready for you at the restaurant. Similar to the medical office. They give you a device, you check in, they give you a device, you can go in your car, and then when they're ready for you, the device vibrates, and you just go in. You give back the device, and you're good to go. However, if you do get a device, you want to make sure that you have your gloves on, or make sure that you wipe that device before you take it. Number 2, leave unnecessary guests at home. If you can avoid bringing your children, partner, or friend with you to the clinic, you should. That way, they'll limit their exposures to other people and won't potentially infect others. So that's number 2. Leave unnecessary guests at home. If you're going to the doctor, go solo if you can. Number 3, call before you go. Call your physician's office before walking in or scheduling an appointment. They may ask about your symptoms before allowing you to come in, or they may have a temporary transition to telehealth for the time being. So you don't want to go there and then you realize, hey, I could have seen you on telehealth. I wasted my time coming down here, but also I increased my risk because now I'm in a doctor's office. So be mindful of your surroundings, leave unnecessary guests at home, and call before you go. And then lastly, polling places. Polling places. As you probably know, a couple of weeks ago, Wisconsin had voting during this pandemic. And yes, people were in mask, waiting online, trying to stay trying to stay 6 feet apart, but people still got sick. So I want to give you just two ways to reduce your risk. What to do when venturing out to polling sites or polling places. Voting requires a lot of touch. You can't mail in your ballot on that day. I'm sorry. If you can't mail in your ballot, follow the CDC guidelines for in-person voting. Two quick opportunities to help you reduce your risk. Keep your distance. Like always, stay 6 feet apart from other voters when you're waiting in line or in the booth or in booths. And there should be hand sanitizer. Remember, it must have at least 60% alcohol to be effective. You can use before and after you use a voting machine or complete your paper ballot. Consider off-peak hours. If you can, come to the polling place at an off time. But voters or fewer voters will be packed into the room with you. And lastly, if you can get your ballot before and mail in your ballot, that'd be the best option. So keep your distance, consider off-peak hours, and that should help to reduce your risk. Thank you for your time, and this ends our 3-part or our part 3 of venturing out with COVID-19 as we venture into airports, clinics, and polling stations or polling places. Stay tuned for our last installment of this 4-part series. Take care, have a good day, and we will connect next week.